I've had some feedback on my Facebook page about my previous video that stated we don't need a public option. There has been a little confusion, so I wanted to make sure to clarify what I meant. H.R. 3200 has in it a national health exchange that includes a public option as well as private insurers who want to participate in that exchange. It also sets up a mechanism for people who do not qualify for Medicaid or other government benefits but do not have employer-provided health care to purchase a plan over this exchange on a sliding scale basis. This, combined with the prohibition of pre-existing condition clauses, the elimination of maximum annual and lifetime benefits, a ceiling on the amount of money that an insurer can charge their customers in the form of cost sharing, and a requirement that insurers cover preventive and other required health services provides for universal health care coverage that is affordable to all. So, what would happen if legislation was put forth that accomplished the goals of affordable universal coverage on a sliding scale with those added regulations, but did so by allowing people to buy into the federal employee health care plan instead of a public option? Well, people like Congressman Weiner are saying that they would oppose this legislation just because it didn't contain a public option, even though it accomplishes the same goals of universal coverage at affordable rates for all people and additional regulations on the entire industry. This is what concerns me, that Congressman Weiner would vote to not accept full coverage for all those people who are currently uninsured or underinsured just because it didn't provide those options in the way that he feels it should. It doesn't make any sense at all. Now, any legislation that does not provide universal coverage for all people at an affordable rate via some sort of sliding scale, or that does not cover those other regulations that are so vital in reforming our healthcare system should absolutely and 100% be rejected, period. And when it comes to the things like end-of-life counseling, Democrats need to grow a spine and not only make those who suggest that such counseling amounts to death panels to look like even bigger fools than what they already are, but they also need to remind conservatives that those ideas were originally proposed by conservatives. But if the legislation accomplishes every goal in H.R. 3200, but does so in a different way, opposing it is just like cutting off your nose to spite your face. Because again, the people who lack health care do not care if the plan you provide them is on a public option or not. All they care about is that they get affordable health care so they can take care of their families. And that should be the ultimate goal of everybody fighting for health insurance reform.